Hello, today I will be talking about affordable healthcare in Laramie. This is for Understanding Community Leadership 4117/5117, Section 40. The issue of this project is something that I think comes up a lot of the time in the community. This is that there are really no places that have an affordable healthcare option in Laramie. Along with this are the different demographics of people in Laramie and that there are also low SES families that might not be able to afford all of the health care that they do need. So there might be more travel time that goes into it, and that means more money that they do have to pay. My initiative would include sending out emails to connect more with the community. I want to be able to know what these families are going through, and I want to hear their side of the story and understand what needs to be done to start helping people. Starting to plan out what other options could be presented in the future and how we can get that going to help from the community is something that is also really important to me. And within the next 5 to 10 years, I would hope to see a start to different and more affordable healthcare options that everyone in the community can access at any point in time that they need. There are a lot of stakeholders that come to mind when working with a hospital and the healthcare system. The first one that I think is the most important one are the patients. They are a direct link to the community and what experiences they are going and know what experiences they are going through. They are the people that need this the most and they are already giving their time and energy into the hospital. The second one would be the insurance companies. So there are both positives and negatives to this one. The insurance companies are still a company and they need money to keep moving on forward. However, they might be able to help us with all the financial parts to what this project would look like down the line and what we would do in the future. The next would be the employees themselves at the hospital and the other healthcare providers. The what people employees see people on a everyday basis. They know what the community needs and they know people within the community. They also know the ins and outs of the healthcare system, and that could really help us understand it fully and how to move on with our project. Then the final one would be a community board, similarly to a school board. We just want to be able to present this project in front of the community, and we would want to help get all the help that we can have. This gives us a better chance at reaching out to the families that need the help the most. The next part is the social capital. I think that this is a very important part to how we can move forward with this project. The first part to this is the hospital itself. I would want to start to understand how a hospital works, and that goes along with other healthcare systems in the town. I want to be able to build those connections and understand how the healthcare system looks and what we can do and get done to provide it and be better to people in the community. That goes along to the next part of my social capital is the community itself. You can start talking to people that truly need the help and start building those relationships. This starts to get the word around and more people might come into your project and ask what you can do and what needs to be done for the future. Next is mobilizing the project. This is how we're going to get people to come to the meetings and start to ask who would be interested enough to be a volunteer and how they can help us move forward with this project. We would also want to bring in employees from the hospital and other healthcare providers in town and have them talk about the community and answer questions that other people might have just to bring in what our project is about. Then going back to social capital is being able to build those relationships with people in the community. We want people to know what the project is about and what it looks like for them in the community and what can be done for those people with lower SES. Getting volunteers is something that I think is very important to any project. But I think that within this project, I would want a long term volunteer, someone that is very dedicated and has a passion for helping people. I will want my volunteers to have amazing communication skills so they can answer questions that people might have within the community. I would want them to help me organize meetings to spread the word about how we can help the community and what our project is about. Then also being then also helping me out with all the paperwork and being able to file it so we're organized. We want to be able to help people in the community, and I think that with all these assets in a volunteer, they'd be able to help out within this project. Wrapping things up, this class has taught me a lot of different things throughout this semester. Asking for help and getting the right resources is something that I will definitely use more often. I really liked how we used visioning in this class. It has already helped me with different things in my life and within another class, and I'm going to definitely be using it more and more down the line. And I know that with everything that we have learned in this class this semester, I will be using in my career and my endeavors in the future.